Hello, and welcome to Gateway to Being. I'm Kathleen Deal, co-author of the upcoming book Beyond Disease Care. Are you sick and tired of being sick and tired? Do you suffer from one or more chronic health conditions? Does fatigue, depression, or anxiety affect your everyday life? Have you been going to various doctors and specialists in the hope of finding relief for your chronic allergies, headaches, heartburn, constipation, acne, PMS, arthritis, and so on? In this series entitled Sick and Tired, I will describe 3 key points that I believe every person who is experiencing symptoms needs to know and understand before making any major treatment decisions. These 3 key points are as follows. Number 1, the difference between conventional medicine and alternative medicine. Number 2, the difference between an acute health condition and a chronic health condition. And number 3, the difference between a treatment and a cure. Once you fully understand these 3 key differences, you will have a much clearer picture on how best to approach any health problems you may be experiencing. So let's begin with item number 1. What is the difference between conventional and alternative medicine? Conventional medicine, also known as allopathic medicine or allopathy, is the most widely used form of medicine in the United States. Conventional medicine is a Western science healing philosophy that focuses on the diagnosis and treatment of disease. Visits to conventional medical doctors, as well as their treatments, such as surgery and pharmaceutical medications, are covered by health care insurance policies. When Americans speak of seeing a doctor, they are usually referring to a conventional medical doctor, or an MD, such as family practice, primary care, internal medicine, or pediatrics. If the health condition cannot be properly addressed by one of these doctors, or if more specialized care is needed, these doctors will typically refer the patient to a specialist, such as an allergist, a cardiologist, an endocrinologist, a gynecologist, a neurologist, an ophthalmologist, a psychiatrist, and so forth. Alternative medicine, on the other hand, is a general term referring to any healing philosophy or technique other than conventional medicine. Examples include naturopathic medicine, chiropractic, traditional Chinese medicine, and many other vitalistic healing philosophies too numerous to list. Most alternatives to conventional medicine fall into the category of holistic medicine. Holistic medicine emphasizes viewing the patient as a whole, honoring the aspects of body, mind, and spirit. Holistic medicine holds the view that the divine intelligence that created the body heals the body. Therefore, the key to reversing chronic health conditions lies with identifying and removing the interference patterns present in our lifestyles. Rather than simply identifying a symptom and then suppressing it with pharmaceutical medications, holistic medicine asks the question, what is the root cause of this symptom? As many proponents of holistic medicine will tell you, the root cause of illness is almost never a deficiency of the pharmaceutical drugs used to treat those illnesses. Rather, the root cause most often lies in what we are doing, thinking, and feeling in our everyday lives. When you ask your conventional doctor about alternative approaches, chances are he or she will discourage you. You may be told that herbs and other nutritional supplements are unregulated, unscientific, or unproven. This is because most doctors were taught in medical school to view non-conventional therapies as quackery, a waste of money, or potentially dangerous. Unfortunately, many doctors have blindly followed this teaching without researching the facts for themselves. They mean well, but they are operating on a half-accurate theory, a theory that is deeply rooted in a system of medicine that has come to put profits before the well-being of patients. The majority of the problem lies in the fact that medical research is geared toward creating treatments that can be patented and sold for profit. Treatments that cannot be patented, such as spinal adjustments, massage, dietary changes, exercise regimens, fresh air, breathing exercises, vitamins, minerals, herbs, and so forth, make no money for the conventional medical system. Proponents of natural and holistic approaches often condemn conventional medicine, swearing it off completely, believing its approaches do nothing but pad the system's pockets while causing irreparable harm to an unsuspecting population. What do we do when conventional medicine puts down alternative approaches and holistic medicine puts down conventional approaches? Is one philosophy good and the other evil? Is one right and the other wrong? Well, the truth lies somewhere in the middle. All healing philosophies are valid, and all serve a useful purpose. So the question becomes, which healing philosophy is best for your particular health challenge? The answers depend on many factors, the first of which has to do with understanding the difference between an acute health condition and a chronic health condition.